Good afternoon. Thank you for joining us at Welcoming Wellness, where we are empowering mental health. I want to tell you a little bit about myself. I'm Robin. I'm going to be your monitor for today's presentation. Also, I wanted to let you know kind of what our goal is with Welcoming Wellness. And what we want to do is we want to provide knowledge and resources for people before and during a mental health crisis. Kind of a one-stop shop. We're building a video library on our website, which is welcomingwellnessnc.com. And also, we want to help to decrease stigma so that people will feel free to reach out when they have a need and not be concerned. Let's talk about our speaker today. James Osborne. He is the Director of Community Education with Alliance Health, and we are thrilled to have him with us. He's going to talk to us today about new behavioral health and intellectual developmental disability tailored plan. He's going to talk about Alliance Health and their affiliation with the state of North Carolina and Medicaid. And he's going to talk about the type of mental health programs that Alliance continues to support and give resources to here in our area. So please join me in welcoming James Osborne.
I've been working in the field for over 30 years. I got into the field because I also have family members that have mental health challenges and developmental disabilities and substance use challenges. So that's part of why I'm here. It's because I want to help you, help your loved ones, help yourself be able to navigate our public behavioral health system and specifically the Medicaid system. I'd like to start, again, we're here to provide important information about the North Carolina Medicaid program and its benefit plan. And today I hope that you'll have a better understanding of some of the basics of what Medicaid is, who is eligible for it, how to enroll, and how to make sure that you have the information that you need and be able to move forward. Many people have heard some of the challenges that people have in navigating that system. We'll go ahead and do the next slide. I'm going to start at and this is how we had Medicaid expansion that occurred in March 1st of this year. So I want to kind of focus on that first, and then we'll do a deeper dive into specific types of Medicaid plans and how you can use the information to find the help or resources that you might need. Okay, next. So here in North Carolina, the title of the slide here is Local Management Entities and Managed Care Organizations. A lot of the definitions is what makes things difficult because we are trying to communicate. So I want to provide you with some definitions. The local management entity, that is what Alliance Health is, along with other companies that manage your Medicaid health plan. We are managing, local management entity is state and county dollars. And those are for people who are uninsured. So the state of North Carolina and Raleigh at the Division of Mental Health gives money to Alliance, and we turn that back into services for the counties that we serve. And then the MCO part, the Managed Care Organization, is around the federal dollars, which is the Medicaid programs. So we have three sources of incomes, and they're handled in different ways. So you can, from the map, when you're looking at the divisions here, there's four companies that are covering this area, and of course it would be Alliance Health would be one of those, along with Partners is in the center part of the state. Trillium is down east, and the Via is more towards the mountains. So many times the counties are connected. So these are four companies. We all do the same thing under the state of North Carolina in order to administer those LME, the local management entity dollars at the state and the county level. And then each of these companies also manage the Medicaid dollars, which is the federal dollars, which is part of the Medicaid health plan. When we talk about Medicaid up at the top, 1915B and C waivers, there's various types of Medicaid plans, and I'm going to describe to you the various types of health plans and what some of those qualifications might be. Okay? So here's how Alliance fits into the picture, because we are, So we are covering these 7 counties in North Carolina. Again, we started with Durham, Wake, Johnston, Harnett, and Cumberland. You can see they're all kind of connected there. And then and and we and then Mecklenburg and Orange County actually came to us in 2024, and then most recently that was 2021 was Mecklenburg and Orange, and then we added in Harnett just recently in February. It was a realignment of the counties. Okay, so we are serving 190 individuals that are eligible for Medicaid or they're uninsured with state-funded services. We don't provide any direct services. None of the LME-MCOs, which Alliance is one of, we don't do direct services. We're managers of the care. We're helping people navigate system and connect with over 4,000 providers that are within this catchment area. And we're offering, again, those different types of Medicaid plans. Our mission is to improve the health and the well-being of the people that we serve in our communities that have complex needs. So what Medicaid has happened is that we've gone from people with low to moderate needs, and there's a type of health care plan for them, which is called a standard plan. And then there's people who have more complex needs that would end up with Alliance. What's an example of a complex need? When you take behavioral health, and then you also have physical health challenges on top of it. And then each of those conditions may be, again, low, moderate, or high. And if they're having low to moderate challenges around that, that again can make their needs more complex. Sometimes complexity is also based on the cost and the frequency of which they see certain services, and ways in which we can help them find a better way. Again, the person is driving the services that they get. Our vision is to create equity, and that's why we're so excited about the expansion of Medicaid, because we want more people to be able to be insured and have access to care. Okay, our values are around accountability, integrity. We want to collaborate. That's why I'm here. It's about forming relationships, connections. My passion for this, my compassion for this came from my family and the people closest to me, and wanting to make sure that people get connected and get the help they need, and that comes through customer service, dignity and respect, and innovation. Okay, they have an annual report available to you online, so I encourage you to check that out. Next. And I'm part of the community health and well-being team. We believe that health comes from housing. We're a health care plan with a housing plan. How do people get well if they don't have food, shelter, clothing, and the supports that they need? We call it social determinants of health. These determinants many times drive people's health. People are not able to get well if they can't get to the appointments. And so we have put in a whole plan around that. Part of community health and well-being is also similar to why I'm here today, around reducing stigma. A lot of that comes through education and correcting or finding out what the facts are, or dealing with some of the myths. We've got to be innovative and come up with partnerships. We're very closely aligned with each of the county and the county governments that work in each of our departments, counties, specifically social services and departments of public health are very much in line with the work that we do. More North Carolinians can get their health care through coverage through Medicaid. This has been a game changer for more than 600,000 people who now have access to health care. In addition to the people who are already getting Medicaid, this would be covering them before December 1st of 2023. Medicaid now also covers individuals that are 19 to 64 with higher incomes than Medicaid covered in the past. So that means that you may be able to get health care coverage even if you didn't qualify before. When somebody applies, they are first assessed for a traditional type of Medicaid coverage, which used to be for like individuals that might be pregnant, but all of those things are assessed. So Medicaid covers most health services, including doctors, checkups, emergency care during their visits, and most of them don't have any monthly fee, and the copay would be no more than $4. Okay? So let's dive in a little bit more into some of the main health services that Medicaid covers, and it includes all the ones that you see on the slide here. And we really encourage you to visit medicaid.nc.gov in order to get more information in the blue line at the bottom. Most people will be able to get health care and get their coverage through Medicaid if they meet a few specific criteria. And it's important to know that you may get coverage for Medicaid now, even if before that you did not. So the chart on the left side of the slide shows how North Carolina is expanding health care coverage to more people. And if you were eligible for Medicaid before December 1st of 2023, then you still are. If you had Medicaid before, because of these changes, you're not going to lose your coverage. And that's what most people are most concerned about, losing their coverage, losing their service, or losing their doctor. And all of those things can stay in place as long as the network and the doctor and their plan are contracting with us. And this shows, again, what it would mean that how most people are able to get the Medicaid and what those income breakdowns are. Also on the other side, it talks about family sizes and the criteria there. There are also specific rules around whether somebody is a citizen. As mentioned before, they must be a citizen in order to be eligible, but there are some exceptions, and some non-U.S. citizens can still get their health care through Medicaid, which we'll talk about in a few minutes. And there are other specific guidelines around whether it is connected to Medicaid that's specific for pregnant women or whether it's part of family planning. One question that frequently comes up is can I have Medicare and receive Medicaid expansion? And some people who do have Medicare coverage may be eligible for the existing Medicaid programs. For example, if you're disabled and are 64 and you're or under, less than 64 or under, you may be eligible for Medicaid through disability coverage, for example. Okay? So talking about non-U.S. citizens, they can get their health care through Medicaid also, and to be eligible, the person must be living in North Carolina and a qualified non-citizen for at least 5 years. And the criteria is listed here about what is a qualified immigration status and how they would be able to. So we really encourage people to go ahead and make efforts to check and see if they're eligible or not. The guidelines around eligibility and the rules are very specific, and that sometimes can be confusing for people. So we encourage people to go ahead and just see and talk to somebody at social services about their eligibility. Under Medicaid, you do not have to pay for any monthly premiums. That's because the federal dollars, your tax dollars, are the ones that are supporting that program, and that's part of why we're here, because at least a decade ago, the state of North Carolina was talking about Medicaid reform and ways in which they can do containing costs and also improving quality is what that is all about. And so Medicaid is going to cover all those costs for the care, and the highest copay is $4, and many other providers don't. Okay? So if you think that you qualify for Medicaid, or you're based on the information provided, we're going to encourage you to please take the time to complete an application, or recommend that you set some time. It'd be about an hour to fill this out. You may have some specific questions, and again, you want to make sure that you gather all the information that is listed here. North Carolina will make sure that the information that you provide is confidential and that it's accurate. And social services will be working closely with you. So this is a list of the documents that you would take to the Division of Social Services. That would be at Wake Human Services, and they're at our main Wake Med location. And they're going to want to be able to verify that individuals are a North Carolina citizen, but using this criteria. They will also want to make sure that the individual has a certain income level. And again, if people don't have the documentation, they have alternative forms to be able to send out, or that you can fill out, even if somebody is having difficulty with all the verification criteria that is listed here. Because they are definitely going to need a social security number and some verification or validation of the current citizenship, along with verifying your immigration status. Okay. People who had limited benefits through family planning Medicaid before December 1st of 2023, and they met these new rules of eligibility, are now automatically will have full coverage through Medicaid as of December 1st of 2023. So they were automatically enrolled, and they got a letter from the Department of Social Services telling them that they were eligible. What is family planning? This is the type of Medicaid that is given to individuals, provides reproductive health care at no cost to people who have incomes that are 195% below the federal poverty level, which is about $2,300 a month. And it controls for, again, individuals who are of childbearing age, but do not want to have children or need helping with birth control or other family planning products. Okay, next. So there's a variety of different ways. They have tried, again, within the state of North Carolina, to create easy ways in which people can make an application. Again, if people get lost in the process, again, please direct them to our call center or to the Medicaid resources that I'm listing here. So you can make an application to Medicaid online through ePass. And so ePass is a secure and self-service website, and you can visit it by going to epass.nc.gov. When you are applying online, you can avoid having to go to the social services office in person, and you can submit the information. So it's really, and the state is able to process it much faster. So it really is the best way to go. Again, medicaid.nc.gov/print and another dash application is the way to find that. Okay, so you have social services, a paper application, or just call them directly. All right, next. So after you've made this application, it will take up to 45 days in order for you to be, for the application to be fully covered. And if your application is not complete, of course, it's going to take longer. And a few ways that you can do this is by using the ePass system. They're really encouraging that. Okay. Once you are approved for Medicaid, this will be, then you will have an ID card, which will come in the mail. Most people who get their health coverage through Medicaid are part of the NC Medicaid Managed Care. That's the MCO part that I mentioned before. Remember I mentioned LME MCO? That's the managed care part of, but they will find which program is going to be the best need for you. One other question that comes up is about what is the difference between Medicaid expansion coverage and getting coverage through a standard plan, tailored plan, tribal option, or Medicaid direct plans. So those are the 4 different types of Medicaid plans that are out there. Standard plans, those are those low to moderate needs, and there's 5 healthcare plans that cover that for the whole state. Then there's companies like me who are the tailored plan. Remember, we're part of the complex needs, and there's 4 of those divided by the state by geography. We also have a carve-out plan that's specific for people who have a tribal options, again, or individuals who are members of tribal nations, and Medicaid Direct are individuals that also have more physical health types of needs or have needs that are covered through other services. So that, again, this matching, so Medicaid becomes a complement to the plan they're already getting. Next one. So there are some individuals who are still not eligible, or sometimes they have to wait in order to get coverage. So we encourage them to call our call center to find out about other services that they may be eligible for, especially if they are, because we would be covering people not on a Medicaid plan who are uninsured. Okay, next. So remember, North Carolina has expanded our healthcare coverage to more people, and you might be one of them. And more than 600,000 people are now able to access health care through North Carolina with Medicaid. Our hardworking people like you, or people that you know in our community, are finally able to get some of the health care that they need. When you look at the health care plans, of course, all our health care plans are different. And when you look at how much service you get through the Medicaid plan, you have a larger service array. When you're looking at people who are underfunded or uninsured, through the state and county dollars, it's a much smaller list. people can still get services, but we don't have as a robust list. I'm going to go ahead and transition to a second topic now, which is just talking more about the tailored plan. Okay? So next. So Alliance Health and the 4 companies in North Carolina, Partners, Trillium, and Via, all manage the tailored plan. So part of a tailored plan is a managed care organization, and managed care means that we pay per member per month for the services that are delivered. So it's more driven by the person than it is by just billing for smaller increments of time. Next. We are covering up until July of this year, actually, is when the tailored plans finally launched. So this is new. We have been preparing to be a tailored plan for over 5 years. We have been doing the behavioral health portion of the tailored plan for 12 years. And many of us, like myself, had already been part of the public behavioral health system for many years before that. So as the expansion of July 1 of this year, then that's when the tailored plan launched. We were able to not only cover our members for their behavioral health, but now we had their physical health, and we also had their pharmacy services. That piece used to be managed by another company in North Carolina, and so the care got divided. You see, right? So we're really looking at continuity of care. That's why the changes within the Medicaid program make sense and are best for individuals, because you have an integrated care model. So the same information about you is being shared not only with the doctor, but also with the therapist, with the pharmacist. All of that is connected. And that's so important to make sure that people are getting the care and the help that they need. When we talk also, next one, when we talk about disability areas, when I talk about behavioral health, and we're talking about mental health is one area under behavioral health. Another one would be substance use disorders, intellectual and developmental disabilities, which are 2 disability areas. Intellectual disabilities, not able to process information as quickly as you and I, or developmental disabilities that are incurred before the age of 18. And then the next area, or the 5th area, is the traumatic brain injury. I have information on all of this on the side for you, so I'm going to encourage you to pick that up. And talking more about Alliance Health as far as the tailored plan, but also specific services to TBI. Okay? Individuals, when they enroll, become Alliance members, they will get a health card just like any other health plan. Next. And they'll be able to choose their providers. And many of them will continue to be with the same providers that they've had before, because they've already been part of our network. So that was part of becoming the tailored plan, was bringing all of the physical health side into the network. Okay? So we want to help individuals know what to expect. So if you're on the left side there, if you're calling for this type of service, then over the right-hand side it'll show you your appointment should take this amount of time. Because access and getting people, many times when we don't feel well, we need to see somebody right away. But know that service is always available to you by calling our call center. These other services are listed here, are giving you some estimates about how long individuals will be able, and when they will be able to seek help. Okay, and then the list continues here around routine care, urgent care, and emergent care. Okay, and next one is not letting individuals know that we also would have specialty care, just like any other kind of health care plan. So if you think that a specialist is needed, encouraging people to talk to their primary care doctor. And also the Medicaid plan is driven by a care manager. So I would encourage people to ask for a care manager. Someone can help you be able to navigate the system and get connected to the providers that can then be responsible for the long-term care. Also, if somebody has a physician who is not part of the network, there is an out-of-network referral process that can occur. Because individuals can have, the Medicaid comes from their county of origin. So the social services office where they live is where the Medicaid comes from. But then individuals may move to other parts of the state. So it's, and so that sometimes can create an out-of-network if somebody has moved to another part of the state, but they still are on our plan. But we have a way of making sure that people get the care that they need. Okay? Same goes on with your primary care. None of this is going to require any type of referral. It just really is talking to the primary care doctor, and then if you are getting stuck in at any time, then that's why we're providing you with our call center number and our member and recipient number in order to call to get further help or going back to your primary care doctor. Next, same thing as with behavioral health services. Again, people who do not need referrals for this, they're able to access directly or call us if they're having difficulty finding access. Next, same thing happens for emergencies. I want to highlight, especially when individuals around behavioral health are having an emergency situation, we are encouraging them not only to call 911, but also to ask for a CIT officer. So CIT stands for Crisis Intervention Team. Raleigh, Wake County was the first county in North Carolina to even establish a CIT program through another good resource for you, which is NAMI Wake, which is National Alliance on Mental Illness. I'm part of their board in Durham, and we support all the affiliates, and then covered through their statewide. They work with the CIT program to provide that to all of the, there's over 17 different law enforcement departments in Wake County, and they work with all of them. Specifically here in CARE, they even worked with specialized officers who were veterans, for example, so that we are able to connect veterans with other veterans and when they're having. So 911 and CIT. Another resource is 988, and I'll mention that again to make sure that, so that you know that we have our own number now as for psychiatric, mental health types of emergencies or crisis or suicide warning. Okay. The services covered under the Alliance Health Plan are very similar to many of yours. So there is a list there, and the list continues on the next slide. What might be a little bit different within a Medicaid plan is that the vision care underneath is also included in there. Some of our vision plans, at least mine, is separate from others. Okay, next. Medicaid is also providing non-emergency types of transportation for individuals. I mentioned around how some of the determinants, some of the factors that make a difference as to whether people get well or not is whether they can keep their appointment or whether they can even get to the appointment, and this especially is important around rural health. So we have Medicaid is now providing us one of the benefits of non-emergency types of transportation. There's also services next that's called the, one more, long-term supports. If you have certain health conditions and disabilities, you may need help with your day-to-day types of activities, like eating, bathing, doing household chores. You can get that if you're, again, a member of our Alliance Health Plan. You'll be able to get that through a group of services that's called long-term support services. It's more like your home health or your personal care. And you will also, a good person to talk to about adding these to your service would be your care manager. The care manager, again, is a specifically trained mental health professional that can help work with you, with your doctors, with your providers to help you make the choices that are best for you. We believe in an equal shared decision-making process. So the individual, again, we call them members, but the individual and our staff are able to, again, have valuable information that helps make the best decision for them. It's also called self-determination. People have the right to choose what's best for them, and we're here to support them in that. Again, the care manager can also provide added supports that are needed. And if you have questions about long-term support benefits, again, talking to your primary care doctor, talking with your care manager, or just calling our member and recipient number would all work. Okay? All of the health plans, the Medicaid health plans that I just talked about, all contain some of the same elements. And one of the same elements that they all contain are added services. So these are those added services and things that certain people might need in order to get well, and to find a quality of life, to find their wellness, right? Okay. So when we look at this, it's very important for us to have specialized health types of camps for youth that might be struggling with asthma, or a camp that focuses on kids struggling with diabetes, or YMCA around social interactions and weight management. And so as part of being, if they were a Medicaid member, then they would be able to have enrollment or have access to the benefits that are listed on the left-hand side. Same thing goes with the GED, also supporting individuals through the quit line of tobacco cessation. Again, over 90% of individuals that have severe persistent mental illness use tobacco-related or nicotine products, and they die usually at least 20 years prior to others because of the complications related to either nicotine products or related to their not having those social determinants of health, living in poverty, access to food. All of that contributes. So we definitely want to make an effort here to help people deal with tobacco or nicotine dependence, just like any other health condition, and give them the tools and the products they need. Patches, gums, along with education. So that's going to be a part of every health plan that you would have. The other ones listed here, of course, are carpet cleaning. Everyone's like, hey, I want a carpet cleaning. And you also, I didn't realize how important that was for individuals that have asthma. So these are also disability specific, but ways in which you could also improve, of course, your the air quality, environmental quality of any space that you're in, along with a proper vacuum. All right, next there's the list continues of other added services. Because air conditioning and hot conditions also can add to certain health conditions. It makes it very difficult for individuals to breathe. Part of our wellness is what we eat, right? And so want to make sure people have access to nutritious foods, but also knowing how to cook those foods is also important. And the phone, that same fleet phone, again, if people do not have a phone or they're concerned about the minutes on their phone, they may not, and we need to make sure that we have a way of communicating with them through the phone. So we're giving them a phone so that you have a way of making sure they get reminders and the communication. Okay, next. So people are going to have questions. A lot of the information that I provided today is many times can be confusing. People are not sure where to go as far as it really becomes a system navigation. In Wake County, we have so many resources. Here in Cary, we have so many resources, but how do people get connected to that? So as people are trying to access our services, we want to make sure that they have a member handbook. We want to make sure that they know who their primary care doctor is and being able to and form that relationship. You know, some people don't do that, and they just wait until it becomes more emergent or an emergency, and then they'll go. And also getting connected to a care manager, along with our member and recipient number that is available along with our websites. Next, I'd like to provide you with a few more helpful tools. Next, and that would be related to, of course, us, the providers. Mentioned about 911, and there's the CIT officer again, and how important that is. They really know how to slow down the process. The other reason that CIT is so important is because it's a jail diversion program. So when individuals are needing help and they're being picked up, sometimes they will be taken to jail for misdemeanors like loitering, trespassing, open container. Those are misdemeanors that could land somebody in jail, but we would prefer to get them to treatment. And this is a way in which they are able to take people to our community-based treatment facilities. So it's really an important, critical piece in dealing with some of the stigma that does happen as a result of some mental health challenges. We also have established, just like your urgent care on the physical health side, we've established now behavioral health urgent cares. Again, people need to get the services right away when they need it. We also have those crisis and assessment centers that would be like Wakebrook, that's there by Wake Med over by Holly Hill. So there's that facility. Again, not every county in North Carolina has that. For our counties, we have that in just in Durham and here, Johnston, and Fayetteville with Cape Fear Valley. But we want to make sure that people have, again, a non-hospital based type of location to go. And encourage people to access these services. These are all services that are in your crisis continuum, and hope that people will get help sooner rather than later, and also be able to access these services versus your emergency department. Mobile crisis is a team of professionals who will come in plain clothes and provide that service wherever you are. And NC START is another mobile crisis unit, but it's specific to people with IDD, intellectual developmental disabilities. Next. All our numbers are located here. Those are available to you. Next. 988 was a game changer for mental health in America. If you think about a three-digit number that you can call. I mean, if you had to call the sheriff, which you know the sheriff's number, if you had to call the City of Raleigh Police Department or Cary, which you know their number? No, we just know 911. Well, we didn't have a number in mental health, and so when people had to call, we had to call them to call 1-800, and it was a long number. And so now we have 988. So we're really, and North Carolina has invested a lot into the 988 system. We're getting thousands of calls on a regular basis that people are, and so it definitely is working. And it also provides a texting option for individuals. So we really want to encourage people to know about 988. And be able to access it not only if they are feeling suicidal, but also if they're having any type of crisis. And this could be your lifeline. I've used this lifeline before for my own family member, and so I know that it works, and they'll just step you through the process. They eventually connected me to a CIT officer who was then able to go and make that safety check on my family member through using this 988 and our national crisis line. Again, crisis can go here to the 988 number. You can also call us with a crisis. We will provide the same type of triage and identifying, again, the screening for the routine, urgent, or emergent. We'll triage that. We'll find out what the disability area is and then make an appropriate referral. So really, the goal here is no wrong door when individuals are calling and getting them connected to what they need. Next. A lot of people like to use the United Way 211 number, so that's another great resource. With Hurricane Helene, they have definitely been highlighted as a statewide agency that is able to connect people to resources. And another one is NC Cares 360. This is a new program that has been launched in the last year that is looking to do, when I talked about integrated care, this is about bringing together the resources and the care managers with those resources to help people find what they need. Wake County government gave, on a regular basis through a contract, will give money to Alliance Health to provide you with the Wake Network of Care. So if you have your phone with you today, I encourage you to take that out and just Google Wake Network of Care. This is a national platform where we have put all the information about Wake County government. There is a portal specific to housing. So we have, again, we believe in collaboration, relationships, and bringing together all of the housing organizations so they have a single portal to which people can make an application in order to identify the resources that are needed, because we have a lot of housing resources, but it's not a fit or a match for everyone who is applying. It's kind of similar to Medicaid. It's like it has all this, all this eligibility, and then they have various housing, various plans that are specific to people and whatever place they might be. So, education, health, mental health, it's all there, along with food insecurity issues are also addressed through that. So I encourage you to check that out as an online service directory that's updated. If you don't see a resource on there, it can be added. And we have a person who manages that for Wake County. We have the same thing for Durham also. All right, next. We want to provide resources online through Alliance Health, and part of that is just a free screening. And so you can go to our website and take a screening. These are like a checkup from your neck up. Program is totally anonymous, but it's a way in which you can kind of check in with yourself. So I want to let you know that our wellness begins within ourselves. And so again, we need to be well in order to be well for others, or to try to help other people find their wellness. So I encourage you to use this tool in order to just kind of screen yourself, or just kind of check in with yourself and say, exactly how am I doing? Next. I think you might do the same thing around any kind of a physical health kinds of challenges, but it's really a 1, 2, 3, very straightforward process. Okay. I'm going to encourage individuals to use their phones and use this QR code to do a satisfaction survey regarding our training today. And so that will be provided to you in your handouts, and I'll give people a moment for that. And we'll also come back to this as needed. Also wanted to mention that there's also, next slide, that there's also a survey also specific for the Medicaid plan also, and so they also want to have your feedback. The additional information I wanted to provide you through the handouts that you have, I've mentioned the brochure that is for Alliance Health. Another one that I wanted to mention is this one here, and it is the top. It says, if you're experiencing a behavioral health crisis, the emergency department may not be the best place to go. Reach out to these resources for help. What would make the emergency department not the best place to go if I am feeling suicidal? It definitely could be a place to go, but a lot of the behavioral health community-based options that I've mentioned are better. The reason, and those would be calling our crisis line, calling 988 is also listed here, using the mobile crisis services and some of the services that I've mentioned before. You can go to a behavioral health urgent care, and then we also have the crisis facilities, and there's, again, the 4 of them that were mentioned. And again, what happens at the emergency department is that, for example, I'll use suicidal as an example. You would need to be detained or held there if you continue to meet criteria for involuntary commitment. You'd have to stay there in the ED until your bed is available. North Carolina does not have enough psychiatric inpatient beds for everybody who needs them, so you have to wait. And then when the bed comes available, you would need to be transported into where the bed might be available. That could be here in Butner and close by, but it could be in the mountains or it could be in the coast. And so that type of moving people across to try to find the care is really just not the best options. So we're really trying to encourage people to use more of our community-based types of care. Also want to highlight here that on the card you'll see there's the Hope Center for Youth and Family Crisis. It's for youth that are ages 4 to 20, and it's located in Fuqua Arena. Anyone is able to access that service. There may be only, again, 1 or 2 other places in the state that would have crisis services specific to youth. This is, again, a very unique, and again, part of the resources that we have been able to provide in this area. So I encourage people to check that out. Also, what has also been a shift within crisis facilities is that over half the people in our crisis facilities have probably been there themselves. They are certified peer support specialists. They're people with lived experience. They're people who have been there and done that. They've walked through the same doors. They've found their recovery. They believe in hope and self-resilience, self-determination, resiliency to help people navigate. So our certified peer support specialists are a really important part of people who have lived experience, who can really help others who are in a similar place. I want to encourage you to check that out. And the last brochure, and again, another topic that we can talk about more is about locking the box is the name of the campaign. Lock the box. Where do kids get their drugs? They get them from our medicine cabinets. So thinking about what type of medicines you have in your medicine cabinet is the first step. We have a opioid epidemic going on. And a lot of that is also related to fentanyl, which is another drug that gets laced into it. When you go for a health procedure or a dental procedure or had some sort of pain medicine and there's an opioid-based medication given to you, that's what we want to be able to make sure is held safe and is not being misuse of your prescription drugs. So I encourage you to lock the box, to lock the medicine, put it in a safe place. So individuals could come, ask you to use, your restroom, look through those medicines. That's how people are getting those medicines. And so, and again, 1 in 8 individuals have a substance use challenge. So it's more common than we might think. So we really encourage people to also dispose of those medicines. If you have expired or unused medicines that you're not needing, to please dispose of those in a safe way. And continue to educate ourselves around the use of Narcan, which is a reversal drug, which can be provided through the Department of Public Health here in Wake County. So it's in and there's a whole task force that is focused on ways in which we can deal with this health epidemic related to opioids. So lots of resources here. We, again, if any of the topics that I've mentioned today are of interest to you, we'd be more happy to provide more information about any one of them.
I loved one statement that you said that I thought was so important, and you were talking about helping other people find their wellness. I really like that statement. So thank you very much, and have a good afternoon.